The following webinar is designed for two purposes. First, to introduce you to Hammett Insurance Services, a unique general agency specializing in limited medical, MEC plans, and other low-cost solutions for hourly employer groups. Secondly, we would like to cover a couple of specific solutions for the Affordable Care Act designed for these types of groups. Hope you enjoy. Let me introduce myself. My name is William Hammett. I am often referred to as the broker's broker since I have invested the better part of the last 25 years consulting directly with brokers, promoting limited medical solutions for low-wage or hourly worker groups. Specifically, over the last 10 years, we have been laser-focused on compliance with the Affordable Care Act, otherwise known as Obamacare. A little background on our agency: we are completely independent of influence by any carrier and strictly wholesale, meaning that we never contact employers directly. Most importantly, we are compensated by carrier overrides. That means that there will be no impact on your commissions or the premium that your client pays if we are involved in helping you out. Okay, now that I've introduced myself and my agency to you, you're probably wondering, what the heck do we need this guy for? I know it can be confusing because we have a business model that is unique in the insurance industry. We do not intend to compete or replace you, but really act in the background supporting you in those areas you may not be that familiar with. Our customers are brokers like yourself who represent employers subject to the employer mandate and employ hourly workers and also have budget limitations. The end users are service sector employers with 50 to 1,000 employees in industries like staffing, nursing, and assisted living, food services, agriculture, retail, multiple franchise owners, and really any industry employing hourly workers. Further, let's talk about our niche. As I mentioned, all we do is consult with brokers. To my knowledge, no general agency in the U.S. devotes 100% of their time and effort to MEC, limited medical, and other targeted health insurance products designed to serve hourly workforce industries. Because we do nothing else, we're pretty good at this and have served our broker clients well. We cost nothing and pose no threat to their position with their clients. We only exist to make you look good. Since we mention MEC plans quite often in this slideshow, let's stop and pause for a moment and define what MEC really is. MEC is just a euphemism for minimum essential coverage. These are self-funded health plans of insurance with no deductibles or limits that meet the Affordable Care Act requirements to provide coverage for preventive services such as immunization, routine health screenings, and other preventive type services. One important fact to know is that MEC alone does not cover conditions caused by accident or illness, as we will discuss. Okay, since the subject matter at hand is the Affordable Care Act, let's briefly talk about some of the non-compliance penalties. They come under the heading of pay or play, which simply means that an employer can choose whether or not they want to pay the assessment or the fine or the tax, or offer benefits that satisfy the requirements under the Affordable Care Act. There is not a requirement to comply with all of these. We think that the A penalty, the penalty for offering minimum essential coverage, is by far the most important, and you should avoid, your client should avoid having to pay that fine at all cost. It's a different subject with the B penalty. We believe the B penalty can be successfully avoided, and pay rather than play is the right avenue to take on the B penalty. This is primarily because a plan that does not offer minimum value still has value and works very well in the settings that we put them in. It's a bit of a convoluted argument, and one that comes with a little more explanation, which I will attempt to make in another later slide, or also answer any questions directly. But the bottom line is we believe that the B penalty is optional. Lastly, the individual mandate or individual penalty is a small amount relative to the costs of the A and B, but it is invoked against individuals who do not enroll in a plan that is considered minimum essential. Many states have done away with the penalty for this, but certain states like California and Connecticut and Maryland and Minnesota and Washington and also Washington, D.C. have re-invoked this, and it should be considered. Don't worry about the B penalty, I say, huh? Well, before you get too concerned that I've lost my marbles, the minimum value, or the so-called B penalty, is one that we believe with the proper plan design and contribution strategies can be avoided altogether. But the bottom line is that the minimum value penalty or assessment is less costly than the plan designs required to avoid it. And we can go into some detail on how we recommend avoidance of any penalty payment, but even the amount of penalty that you would have to pay would be at an acceptable level. And historically, we found this to be true. So once again, this is a nuanced discussion. I probably cannot cover it in this slide, but I'd be happy to go into it in more detail with you later. Bottom line, don't worry about the B penalty. Okay, now we have discussed MEC plans. We've talked about the Affordable Care Act. We've talked about the compliance with the various assessments or penalties that an employer might face or how to avoid them. Now let's talk a little bit about a plan design that from a practical standpoint could be offered to your clients. There are two categories of MEC Plus, or the plus referring to additional insured benefits that would cover conditions caused by accident or illness, which, as we know, are excluded from the MEC-only approach. Some of these benefits would be lab x-ray, in and outpatient surgical benefits, medical accident, diagnostic testing such as MRI or CAT scans, and even hospital room and board. Also prescription drugs. The indemnity model pays a benefit with a flat predetermined dollar amount without regard to what the actual cost is. As an example, a doctor's office visit might be $100 under a PPO pricing scenario. The plan would pay $75. Theoretically, the member would be balance billed at a later date for the $25 difference. Conversely, if the clinic offered a $60 visit and the plan paid $75, then the member would get a $15 check on top of after the clinic was paid the $60 it charges. Same concept works for inpatient stays with, in this example, $1,000 per day of inpatient benefits payable and a $5,000 flat rate payable for inpatient surgery or a maternity stay. Under a copay concept, consider the same benefits covered, but instead of a balance bill scenario, this would be a predetermined copay, let's say $25 for the doctor visit rather than the flat amount payable. This $25 would be paid, and then presumably the balance would be payable to the provider, and no amount would be billed to the member at that point. This is in theory. We note that oftentimes in inpatient reimbursement, some of the plans pay on a reference-based pricing basis, and we don't know whether the hospital will attempt to recover the costs from the member that were not payable by the reference-based reimbursement level. This remains to be seen, and something that should be taken into consideration when looking at a copay option. I wanted to add this slide in the presentation primarily because as we emerge from the COVID-19 pandemic, there are many, many hiring challenges involved in the industries that we specialize in, those being the hourly workforce industries. One of the ways that we believe can lead to more success in rehiring or retaining employees are plans with no financial barriers. These plans are known as access plans. Those are essentially the plus parts of the MEC Plus plans we just described. They're very useful and ideal for attracting hourly workers, particularly if the employers pay 100% of the cost. Now, before you worry about that being too expensive for your clients to afford, understand that even when an employer pays 100% of the cost of a basic indemnity plan, that participation level is not 100% or even close to it. Many of these employees have coverage through Medicaid or other government-sponsored programs, and so typically, by experience, we've seen even when an employer pays 100%, they only attract about 65 to 70% of the employees. Furthermore, we think that there should be a built-in escalator in these plans so that in the second year or third year, the employer is willing to as much as double the amount of contribution. Most of the plans come with a buy-up option. It would be very useful in retention for employees to be reminded during the course of their first year or 2 years that they are approaching a threshold where they will be getting a substantially better health plan, and the employer will pay for that. We believe this substantially reduces the turnover numbers, and as we all know, the cost of turnover is far greater than the cost of a small contribution to health insurance. Okay, well, wrapping this up, there are a few final points I'd like to make with you. First of all, how can we help you? How can we offer some practical assistance to what you're trying to accomplish every day? First of all, we can help you avoid some very common mistakes that we've observed over the years. Let me give you a couple of examples. Oftentimes we see brokers tempted to offer a MEC only without the plus, without the insured provisions. Even though this does satisfy the major provision of the Affordable Care Act, it is an extremely poor value with far more dollars going towards administrative costs, fixed costs and profits than go towards the employee's benefit. So we think it's a poor value and probably not a good idea. Also, many employers offer minimum value with the idea that we'll only enroll 1 or 2 people, and you're going to satisfy the B penalty and all that good stuff. But the problem is, if you don't, in many cases, enroll a certain number of employees in the plans, it invalidates the reinsurance contract built in and exposes your client to pretty substantial risks. We think that this is a bad idea, and oftentimes it goes unnoticed until the claims pop up and there's no reinsurance to cover them. So these should be reviewed. All your minimum value contracts should be reviewed, and be happy to do so. Lastly, you do not need to accept poor service. Just because these plans are limited in scope does not mean you have to accept nobody answering the telephone, or bad EDI feeds, or just poor communications. It is not required that the service be less than what you should expect. How can we help you? Well, in a practical sense, one of the things we can do is provide your agency with growth tools or sales tools. These come in the form of scripted questions that we have developed over the years that are very effective in prospecting for new clients. We can also bail you out of any of these costly mistakes that you may have made above. We can gracefully get you out of that and into a less exposed or less expensive solution. What are the next steps? Well, hopefully you feel as though this presentation was interesting enough, and that we hold enough value for you to continue a relationship or establish a relationship with us. We'd love for you to tell us about your clients or your prospects. If after reviewing the information you give us about your clients and prospects, we believe that you're doing everything you can, then we will offer a supporting opinion. If we believe that there are some alternatives or changes, we'll offer those as well. And lastly, we will go to the marketplace and secure binding proposals for you, make comparisons, and argue that these ideas or these concepts are better than what you're currently doing. In any case, we appreciate your attention. We look forward to working with you. The next slide will give you some contact information so you can get a hold of us to allow us to help you out. Okay, thank you for your time. Below are all the contact information points that you would need. Each of those will get you to me directly. I look forward to fielding and answering any of your questions. Hopefully that this presentation has raised a few, and you would be more than willing to reach out to me, and I would be more than willing to spend the time with you to answer them. Please feel free to call me anytime. All these numbers will contact me directly, and I am available to help in any way I can. In the meantime, stay well, be successful, and have a great day.